President Matamela Cyril Ramaphosa declared a national state of disaster 2 years ago. Remember, that was in March of that year in response to the COVID-19 pandemic, March 2020. Wits Infectious Diseases Professor Francois and a group of other scientists say the most disaster measures are no longer needed. They are calling now for the national state of disaster to be scrapped. Remember, currently it's been extended by government to the 15th of February. Professor Fente is joining us now to tell us a little bit more about why we no longer need a national state of disaster. Prof, I'm honored that you've decided to be on my show this afternoon. I normally see you with other colleagues, and I get very envious, but I'm pleased you made the time to talk to me. But very seriously, though, I mean, the pandemic is still there. If we don't want a national state of disaster, what does it mean? It means, are we over it now?
We're not over it. There's lots of stuff to consider. It's been severe. Almost 300,000 South Africans have lost their lives. And what we're saying is we need to start learning to live with the virus, but that doesn't mean we ignore it. What we think is that the state of disaster is not the tool to do that. We can hand this over to the Department of Health through the normal mechanisms. Many of the mechanisms that were given to us by the state of disaster are long past their sell date. And a lot of the sort of interventions that they've been calling for should be discontinued. The latest wave has almost tested the country's immune system as collectively, and our health system has managed to withstand the storm. It doesn't need the levels of protection that the state of disaster was there to try and do. And we really can see no reason for it to continue.
So basically, that will do away with structures like the National Coronavirus Command Council. It will just become a departmental kind of approach, and we as individuals, citizens, are going to have to do our part as well.
That's completely correct. You know, a lot of decisions that came out of that centralized structure can be taken over by the Department of Health. The Department of Health has mechanisms for working with other departments that are well established for other diseases, and that certainly is the way it can be taken forward. The distribution of the vaccine program and all of that can be firmly cited within the Department of Health. We don't see any role for the Nerve Council any further, and what we're worried about is a lot of the decision making there doesn't have the oversight of Parliament. It doesn't stand to scrutiny. You know, a lot of these decisions were controversial, I think, is being charitable. And they need to be interrogated. You know, I think we all have investment in the best response to the virus possible. As for your question about it falling onto individuals, I think there is that, but I think there is still a strong role for government. This is not to say there is no role for the various departments. We're not out of the woods yet. There's plenty to be done. There's plenty of repair to be done, particularly to the healthcare system. But we do need to understand how we take this forward. And a lot of the stuff that we've become very used to over the last 2 years needs to be revisited as we particularly get our children back to school.
Is revisiting them meaning stopping the state of disaster, for example, or does revisiting them going like area by area and say we don't need this one? For example, the ongoing rotational schooling restrictive system, where many people, even parents, even some of them, my colleagues, are saying, oh, we've had enough of these rotational restrictions. We need now to go back to school full time.
So the schooling thing has been a controversy since day one. And I think what people perhaps underappreciate is how devastating children not going to school. I think there's a legitimate concern from parents and teachers about the health of their children being exposed to the virus. And again, it's not to underestimate that this virus does have health implications, even for children who are far more protected than you and I are. But we need to also understand there are tremendous implications for not attending school. For the children themselves, it's been devastating having 2 years of interrupted schooling, particularly for poorer children, but also for the caregivers who've had to shoulder a massive responsibility in the process. So people often say to me, but how can we let our children go to school if there's this risk of this virus? You know, you put your children in the car every day to go to the school. There's a small risk in that. We need to be able to weigh these risks, and schooling, to our mind, is of huge benefit. And as I said, it doesn't mean we ignore the virus. We need to understand that there's going to be discussions about vaccinating children, keeping the children and the teachers as safe as humanly possible, to try and work those both into the equation. But this rotational learning proposal, we think, is the wrong way to go.
Yeah. What about? I mean, because each time we've heard about the restrictions or the different levels of lockdown, there will be indoor specific restrictions. Currently, I think it's 1,000 people. There'll be outdoor restrictions, 2,000 people under the current adjusted level 1 lockdown restrictions. There'll be so many people at funerals, and you're not allowed the so-called after-tears services or gatherings post-funerals, and all those things. That's one aspect. I mean, your thinking there is very clear from what I've read. You want some of those to be done away with. And even the wearing of masks, you're suggesting a relaxation there as well.
So the latest variant has been so infectious, and we know we had all those protections in place, and yet it tore its way through the entire country in absolutely no time at all. It looks like almost, in the case of Gauteng, where I'm based, about 60% of the population were infected in just 3 or 4 weeks. Despite, mask wearing in Gauteng is not terrible. We've got all the restrictions on indoor gatherings and all the rest of it, and yet the virus did all of this anyway. And we've got to acknowledge the fact that these restrictions are actually playing a very small role in terms of stopping the spread of the virus, which is why we're saying you need to be a bit more reflective about what you're asking of these restrictions. They have tremendous impact on our lives, our social functions, and there's a bit of an illusion in terms of what we call the theater of this protection. We've also called for, people wearing masks outdoors is absolutely ridiculous, and we've been saying that for 18 months, is that transmission happens indoors. You can make a better argument for indoors during the waves, but in between waves, for instance, at the moment, there's almost no Omicron or SARS-CoV-2 transmission within Gauteng. Why is everyone wearing a mask if in between, there's no transmission? We should be, if we are going to be wearing masks, the only place for it is pretty much is during the waves. And finally, the people who really we need to be paying attention to protect are the people who are vulnerable. That's the elderly, it's the diabetics, it's the people with chronic diseases. People who've been vaccinated, people who've had previous infection and then been vaccinated, or the other way around, have a lot of...
Professor Fente, are you there? I hope we can get him back, Nape. I'm talking to my TD here. I hope we can get him back, because I've got a couple more questions that we want to, but Prof, are you back, Prof?
Yes, sorry, it's usually my connection just loses it for a few seconds.
No, you're not the only one. It happens to many people while we are on air, but we appreciate your patience. Yeah, so you're making that point around the indoor and the outdoor, and it's perfectly understandable. Currently, with the levels of Omicron being what they are in Gauteng, why do we have to wear masks outside? It's a very valid point. But what about the other screenings? I mean, when we arrive here in our building, in our studios at eNCA, for example, we get our temperatures taken. Some people get and then you write down the contact details of the person and all of that. If you as scientists have got scientific evidence that it is time to change some of these restrictions, I mean, those kind of things should stop as well, shouldn't they, Prof?
Absolutely. It's a complete waste of time, and they've been a waste of time since the start. We're still hearing of fogging, for instance, which is against government guidelines, and yet the government's own departments are still using fogging. We have heard of R500 million being spent on fogging just in Gauteng to fog government, schools and police stations and grants offices. So this is just a complete waste of money and time. The temperatures and the recording of names and all of that is absolutely just wasting everybody's time, and it gives you the illusion of safety when what they should be worrying about is just opening the windows and the doors and encouraging ventilation.
Yeah, ventilation.
We have that problem.
What about this PCR test? I mean, I drove to my wife and we drove to Maputo in November, and we still have to do the PCR testing. I mean, besides the fact that the price has come down to 500 Rand now, which is still expensive in my books, should we still continue with both? I mean, we were screaming and shouting when there were travel bans against us recently.
No, you're completely right. There's absolutely no reason to do a PCR test to cross the border. People in any form. Antigen testing, you're in a private vehicle. It's not like Mozambique has more COVID than we do or less COVID, and you're not substantially adding or taking away from the infection, even if you did have COVID and you crossed the border. So these testing to cross borders, South Africa really needs to set an example and say, no more. No more testing to get into the country. All we want to know is, are you vaccinated, or do you have proof that you don't need a vaccination? So that's all we care about, whether you've got a PCR or not. There's a massive new industry that's come forward with this testing. As you said, 500 Rand is really cheap. It's often thousands and thousands of rands. Then you've got to stay in a hotel if you're positive. It's this industry that adds absolutely nothing but inconvenience and expense to all of us.
Yeah. What about isolation and quarantine if you've been exposed to somebody positive? What is the view, your view and the view of your colleagues in the scientific world?
So the latest variant just tore its way through Gauteng so quickly that it's quite difficult to understand how anyone could not have been exposed to the variant. So to say isolate and quarantine, let's go back to quarantine, which is where you're exposed to something with SARS-CoV-2. Most people are asymptomatic, so you probably were, all of us have been exposed several times without knowing it. So the only way to plausibly quarantine is to actually shut down the entire province for 4 weeks, with everyone staying inside their bedrooms and not moving out of that. And that's obviously not even vaguely practical. So the quarantine regulations have fallen away. Government unfortunately released those and then took them away again. For isolation, it's a little bit more complicated. Is if you are positive, you obviously don't want to infect people. So if you're symptomatic, you don't want to cough on granny and infect granny and potentially even kill granny. So what we've said there is to try for 5 days to isolate yourself. So that's down from the 10 days. We know the first 5 days are when you're most infectious. And then for the 5 days after that, just concentrate on wearing a mask. So there are few people who are infectious after 5 days, but wearing a mask does limit that infectiousness somewhat. So we just try to compromise somewhat. Again, there are some people who, including amongst our authorship list, who actually think the isolation thing is a complete waste of time. That there is just so much infection in a place like Gauteng and probably the whole country, that even those 5 days are completely silly to continue to do.
Okay, well, we're going to have to see if anybody's listening to your views as scientists. After all, we were told that the National Coronavirus Command Council takes advice from scientists. So you are a scientist, Professor Francois, and your colleagues, and you've penned this view that I've read in the Daily Maverick, hence I wanted to talk to you. To me, it makes sense, but I'm not a scientist, but hopefully somebody is listening. But before you go, and very briefly, Prof, I just thought about this now. What if you guys are wrong?
Look, we've been wrong about lots of things with this virus. And I think that we've actually, at the end of the article, we just said the way to deal with this is just keep an open mind. We do need to just keep monitoring. South Africa has very good monitoring systems. And if things do look like that, the virus does something which is completely unpredictable, so it suddenly gets past our immune system in a way that no other virus has done before, we may have to revisit these provisions. Yeah. But everyone knows how to do this. Now, if you and I get told suddenly there's something really dangerous out there, we know how to go and buy our masks. We know not to go to rage parties.
We know how to wash our hands. We know how to do the stuff. We've learned a lot over the last 2 years. Thank you very much, Prof. Professor Francois Venter, thank you very much for your insights, and your time is at Wits, Infectious Diseases.